So for this part of training, we're going to talk about all the different transducer types and the general applications used for each. We're going to walk through the list here one by one, but we got Doppler, linear, curved, endo-cavity, volumetric, sector, matrix, and TEE probes. So let's dive into it. Here we have a very basic Doppler probe. It's considered a glorified stethoscope. It's non-imaging. All it does is, a continuous wave, and it just provides the waveform to actually measure and assess blood flow. So it's mainly for arterial studies, and again, it just identifies fluid, mostly in vascular type of studies to see proper blood flow. Next, we have a very standard linear probe. This particular one is L93. L stands for linear. 9 to 3 represents the frequency it runs at, 9 to 3 megahertz. And here, it looks at a lot of vascular studies. So thyroid, some veins, sometimes the liver, looking for a lot of clots. If you've ever heard of that occurring with ultrasound, trying to identify those. But, pretty standard type of transducer, and most of the machines can run these probes. Here we have a curved transducer, specifically a C51, so curved 5 to 1 megahertz. If you think about what people generally picture in their mind when you mention ultrasound transducer, it's this one because it's the most commonly used one. It's for a lot of abdominal scans for all the major organs. Has great penetration to see deep inside the body, and this has a much greater penetration to see these large organs and send and receive sound at a greater depth than the linear probes can. And so you will see this very commonly used and is generally running on all the ultrasound systems. This is an endo-cavity probe, and these are generally used for OB studies. There are some other types of studies and other specialized type of transducers that are very specialized, very unique, but the benefit of this is, especially for early fetal scans, this would actually go inside the body and get right next to that fetus that is only a few weeks old, 8 weeks old, whatever is needed, but it can see a fetus so early where it's the size of a rice grain and it has a heartbeat, and it can see the heartbeat inside that small form factor. So awesome resolution, and this is just one of the staples of an OB centric type of ultrasound system. So volumetric transducers, the one pictured here is this is also an endo-cavity probe, but the difference here is if you look at the tip, this has a dome on the end, and so what this has is a crystal that's not static. It actually can sweep back and forth with a mechanical mechanism, and what it does is it starts at one angle, fires an image, goes to the next angle, fires another image, and it sweeps back and forth, continually taking all these images. And the ultrasound systems are so advanced, you can stitch these together and give you a 4-dimensional image. People refer it to as 3D. I think in ultrasound, it's considered 4D because that 4th dimension is time, because it's actually calculating time. And so the idea here is that if you can obtain an image that is 3 or 4-dimensional in this case, you can calculate volumes very easily, and you get a very clear image of the structures that you're trying to scan, and you get this really modeled 3D, 4D effect to get a different purview relative to a traditional 2D scan. This is a sector probe. This is a sector 5-1, and these probes, like I mentioned before, are specific to cardiac, and they scan a little bit differently. Their beam forming is kind of collecting information in sectors and then combining that image to make an image on the screen. And what makes this probe really special is that because of its face and the way it beam forms out of the crystal, it can shoot in between your ribs to get a really nice image of the heart without going down the esophagus like another probe is that we're going to talk about here in a little bit. So this is a matrix transducer. It looks just like a sector transducer because technically it is a sector transducer. However, the crystals are not only stacked in a way that is a two-dimensional image or a two-dimensional array. This actually is an array of crystals that is not just across, but it's also deep. So imagine just a line of elements versus a line of elements stacked with another matrixed style of elements, and you get thousands of elements rather than your typical 196 or 128 elements. And it provides a ton of information that gives a lot of penetration and a lot of resolution and a lot of information for the machine to process and put on the image to get a really accurate and clean image of the substrates that we're looking at. So the matrix transducers can occur in T-probes as well, but the matrix technology is just a really sophisticated crystal that just provides a lot more information and provides a four-dimensional image as well. So this is really the newer evolution of a volumetric probe where it had a mechanical sweeping. This is all done with the native crystals on the face of the transducer. And as promised in the previous slide, here's a TE probe. This is a transducer that actually goes down the esophagus of a patient, and it gets right up against the back of the heart. The reason why this is important is because when you go through the esophagus and you push against the heart with this array that I'm going to circle here, there is no bone in between the crystal and the heart. It's all soft tissue. So ultrasound can travel really well through soft tissue. It can identify densities of tissue very well in your image, whereas with bone, it just can't travel through it very well. And so this is really used for a lot of studies to where, healthcare servicers really need to get a very clear and accurate image of the heart. And this is simply the best way to do that.